what is the government's guidance to single parents who have
Good afternoon. I'm joined this afternoon by Dr. Susan Hopkins of NHS Test and Trace and Public Health England and Sir Patrick Vallance, Chief Scientific Advisor. On Monday, I explained that we would seek to consult with mayors and local authorities in areas moving into the very high alert level. I'm grateful to all those in local government in hotspot areas who've been working with us over the last week on how to control the virus in their areas. In particular, I would like to thank Steve Rotherham in Merseyside, Sadiq Khan in London, and local leaders in Lancashire who have worked constructively with us. In Merseyside, where the situation is most acute, we were able to conclude talks quickly. In London, we've worked with the mayor to respond to rising infections across the capital, as well as particular spikes in some boroughs. And in Lancashire, today, we have worked with both Labour and Conservative leaders to agree a package. These were tough discussions, difficult decisions. No one wants to have to implement these measures which damage local businesses, curtail individual freedom, and impose significant strains on people's mental health. But these decisions were necessary because of the rate of increase, not just of infections, but also in hospitalizations and admissions to intensive care. Without action, there is no doubt that our NHS would soon be struggling to treat the sheer number of people seriously ill with COVID. Non-COVID treatments and surgeries would need to be cancelled in order to cope, and many more people would die. So taking action is the right and responsible thing to do, and it is backed up by significant support for areas on very high alert. The job support scheme, combined with universal credit, means that those on low incomes who are affected by business closures will receive at least 80% of their wages. We're providing up to £465 million to help very high alert level areas to implement and enforce the restrictions, in addition to the £1 billion of extra funding for local authorities across the country. We will work with local authorities to allocate testing and introduce local contact tracing. Now, we have not yet reached an agreement with Greater Manchester. I completely understand the reluctance of the mayor and his colleagues to take Manchester into the very high alert level. It's far from a pain-free course of action, and it will mean a difficult time for the people of that great part of the country, on top of the restrictions they've already had to endure since the summer. But I must stress, the situation in Greater Manchester is grave, and it worsens with each passing day. Cases doubled in the last 9 days. High infection rates are creeping up the age range, while cases are 690 per 100,000 for 16 to 29-year-olds. They've now risen to 224 per 100,000 for the over 60s. The number of COVID inpatients in Manchester's ICU beds is already over 40% of the number at the height of the first wave. That number will inevitably rise further, given that hospitalization occurs 2 to 3 weeks after infection. On present trends, in just over 2 weeks, there will be more COVID patients in intensive care than at the peak of the first wave. So I urge the mayor to reconsider and engage constructively. I cannot stress enough, time is of the essence. Each day that passes before action is taken means more people will go to hospital, more people will end up in intensive care, and tragically, more people will die. Of course, if agreement cannot be reached, I will need to intervene in order to protect Manchester's hospitals and save the lives of Manchester's residents. But our efforts will be so much more effective if we work together. Some have argued that we should introduce a national lockdown instead of targeted local action, and I disagree. Closing businesses in Cornwall, where transmission is low, will not cut transmission in Manchester. So while I can't rule anything out, if at all possible, I want to avoid another national lockdown with the damaging health economic and social effects it would have. Alongside our local strategy, we've been working throughout to find other ways to suppress this virus. We're backing our brilliant scientists leading the global effort to find a safe and effective vaccine. We've also secured early access to over 350 million vaccine doses through a portfolio of promising new vaccines to ensure that we're in the best place, and we're taking every possible step to ensure we can move as quickly as possible to deploy a vaccine if and when one is found to work. And we've created a huge diagnostics industry from scratch, scaling up the ability to test from 2,000 in February to more than 300,000 today. I also want to update on our future approach to testing. We're now testing more people than any other country in Europe, but we always want to go further. One of the most dangerous aspects of this disease is that people without any symptoms can infect many others without realizing it. If we can catch more asymptomatic people before they unknowingly pass on the disease to the vulnerable, we can help to stop the virus's vicious spread. So far, it's been difficult to do this, but that is changing. Scientists and companies in Britain and around the world have been developing new tests which are faster, simpler, and cheaper. They've been working hard to discover and evaluate new testing technologies. Though there is work to do, it's becoming clear over the past few weeks that some of these new tests are highly effective and can help us save lives and jobs over the winter. We've already bought millions of these tests, some of which are very simple, meaning you simply need to wipe the swab inside your mouth and can give a result as quickly as in 15 minutes. Some of these fast tests work with saliva, and we're already using these in hospitals. We've started building the infrastructure for domestic manufacture of these tests, ensuring that Britain has the ability to produce millions of fast tests here. Over the next few weeks, we will start distributing and trialing these tests across the country. This will enable us to do quick turnaround tests on NHS and care home staff much more frequently. By testing more frequently and quickly than ever before, we can help prevent the spread of the virus spreading through care homes. And we will be able to test students in universities with outbreaks, as well as children in schools, helping us to keep education open safely through the winter. And we will make tests available to local directors of public health to help control localized outbreaks, handing more control from London to all parts of our country, so that those on the ground can use the tools we give them as they think best. And I've instructed my team to ensure that Liverpool City region, Lancashire, and any other areas which enter into the very high alert level are immediately prioritized for those tests. This will make a big difference in how we protect people from this disease. But it's vital that we all take a cautious approach to this new technology. First, it will take time to develop this plan. No country in the world is regularly testing millions of people, so we need to take the time to establish how to do this effectively and safely, and to build the logistics and distribution operation necessary for a large-scale operation across the country. Second, we won't be able to use testing to get business back to normal quickly. In time, we want to use tests to keep open more parts of the economy that have sadly been closed. But it is crucial that we make sure that such systems work safely. And I must level with you that it will take time to get this right before many organizations can buy and operate these tests themselves. Third, This will need a huge effort across the country, and we will need hospitals, care homes, schools, universities, and other organizations to work with us as we develop this plan. But the most important thing is that people isolate if they test positive. If you test positive with one of these fast new tests, then you must stay at home. If everyone follows the rule and self-isolates if you have symptoms, get a positive test, or come into contact with someone who has the virus, we will suppress the disease. And we must all remember that this virus thrives on human contact. So we must do everything in our power to limit its spread. Always think, hands, face, space, ventilate your buildings, wear a face covering in enclosed spaces, keep your distance from others, and make sure, as I say, that you improve ventilation when spending time indoors. If we all do these simple things, we'll protect each other from the virus and we will defeat it together. I'll hand over to Patrick Vallance, who will run through the latest data, and we'll then go to your questions. Sir Patrick.
Thanks very much, Prime Minister. Can I have the first slide, please? I want to talk through just three numbers, which is the prevalence, i.e. the number of people who've got the infection in the UK, the incidence, that is the number of new infections every day, and the R value, which tells us how much this is spreading between people. So this is the data that comes from the Office for National Statistics survey, which is the most reliable way to get a handle on what's happening across the country. And it's an estimate of the number of people who have COVID at any one time. And what you can see is that from May, the numbers went down and they got down to quite low levels over July and August, but then began to creep up during August and now have taken a big increase again in the last couple of weeks. And the latest data from the ONS estimate that 336,000 people have COVID across the UK in the last 2-week period. So that's the sort of numbers we're talking about in terms of the prevalence, the number of people with the infection at the moment. Next slide, please. The incidence is the number of new infections per day. And again, the best way to get a handle on this is not the number of people who are being picked up through test and trace, because that's just a proportion of the total. It's not the total. So you have to do it through studies like the ONS study, which take random selections, or you do it through modeling as well. And here are some of the results from two of the big studies, the ONS study, which I've talked about, and the REACT study, which is also a big study done across the country, and then the data from the modeling group, SPIAM. And what you can see is that they're estimating tens of thousands of people getting new infection every day. In the REACT study, between 41 and 53,000 per day. The ONS, 22,700 to 38,200, and the modelling suggesting that it may now be as high as between 43,000 and 74,000 per day getting the infection. And all of these are a bit lagged. They look backwards, so we would expect it to be towards the higher end of these at the moment. And you will have seen other data today suggesting as high as 47,000 per day. So that's the sort of number that's getting infected every day. And then the third is the R value. Next slide, please. And here what we've shown is the R range. And you remember it's not a single value, there's a range from time in May through to now. And the first thing to say is that the red line points out when the R is 1. And at 1, the epidemic stays at exactly the same level. Below 1, it's shrinking. Above 1, it's growing. And what you can see is that the R stayed pretty flat at somewhere between, say, 0.9 and 0.7, all the way through till the end of July. And then it began to pick up during August, breached 1, and is now up at somewhere between 1.3 and 1.5. That means for every person with the infection, on average, they're infecting 1.3 to 1.5 other people. In other words, the epidemic is growing. But what you can see is that the R hasn't gone back to where it was and where it would be in an unmitigated epidemic of this disease, which would be at around 3. So it's gone up, The epidemic is growing, probably between 4 and 7% per day, but that R hasn't gone right back up. And the reason it hasn't gone right back up is because of the measures that everyone is already taking. So reducing contacts in environments which then foster spread. Certain environments are more likely to do so, poorly ventilated and so on, and making sure that people who've got the infection isolate. But we're not where we need to be, which is to get the R to 1 or below. So there's a bit more work to do to get it down to where it needs to be. Next slide, please. To move from national to regional, and the CMO showed similar slides a while ago, but actually these have now progressed, unfortunately. So if you take the left-hand side, it shows the weekly cases per 100,000 of the population. And on the right-hand side, it shows how fast that is growing. The darker the color, the darker the purple on the left, the more the cases. The brown color on the right shows growth, and the darker the brown, the faster the growth. And what you can see is that there is a concentration of high levels of cases, as we know, in the northwest, the northeast, the Midlands, and increasingly in other parts of the country. And that the growth rate is fastest also in the northwest, some parts of the northeast, London and some other areas as well are increasing in terms of the growth, but there's growth pretty much across the country. So the epidemic is growing everywhere. And as the CMO said, it's important to look also by age how this is growing, because we know that once it gets into the over 60s and the over 65s, that's when you start to see a big increase in hospitalization and unfortunately the serious complications, including, of course, some people who will die from this disease. Next slide, please. So this is the distribution by age of over 60. Again, purple is number of cases, darker purple, more cases. And on the right-hand side, it's where we're seeing growth in this age group, how quickly this is growing. The darker the brown, the more the growth. And what you can see is, again, we're seeing an increase now in the number of cases in over 60s, particularly in the northwest and the northeast, but elsewhere it's growing as well. And you can see the growth rate is fastest in those areas as well. So this epidemic is growing. It's growing everywhere. It's growing faster in some places, and it's spreading to older age groups. Next slide, please. This is represented in this heat map. So let me take you through this so you can understand what this graph is showing. It's giving you different age groups. Well, let's look at the southwest to start off with, down the bottom left. Yellow means rather few cases. As the colors get darker, the number of cases are higher. The age groups are such that the lowest ages, the youngest ages are at the bottom and the highest ages at the top. And what you can see in the southwest is that from mid-September through to October, there's been a gradual increase in the number of cases, particularly in the age group of 16 to 29. Not much increases yet in the other age groups. But if you now look at the northeast and northwest, what you see is that as the cases increase in the younger age groups, they gradually spread to the older age groups. So that you see, let's take the northeast, for example, you see the cases in the 16 to 29-year-olds going very high. And as they go high, you then see the cases increasing in the 30 to 44-year-olds, the 45 to 59s, and of course the over 60s. So we're seeing a gradual trend of increased numbers in the young, moving to increased numbers in older age groups, and that is happening now across the country at different rates in different places. Next slide, please. That in turn is leading to increased hospital admission rates, as the Prime Minister has said. This is admission rates per 100,000 of the population from July through to October, split out by age. And you can see that there is an increase across most age groups. And of course, it's obvious that you're seeing an increase there in the over 85s, but also in the 75 to 84s, the 65 to 74s, and indeed in younger age groups, 45 to 64. And if you look since August, about 40% of the cases in hospital are under the age of 60. So it's not just older people who are going into hospital, younger people are as well. Next slide, please. The hospitalization is increasing, and so are the intensive care rates. And again, this graph shows the increase in people in intensive care with COVID since the beginning of September. You can see quite a significant increase there, again, split out by age. And you can see the relatively big increase across all age groups, really from 45 onwards in terms of the admission rates into intensive care units. Next slide, please. This shows across the regions where it just mirrors what you've seen in terms of the case numbers. Northwest, Northeast and Yorkshire, highest numbers and increasing, Midlands increasing, London beginning to increase, and you can see other areas lower, but in all areas increasing a little bit. So I'm afraid the news is that although the R is such that the epidemic's growing, it's growing not as fast as it was back in March or April, but it is growing, and it's growing more slowly because of the measures we're taking. And if we take more measures to get that below 1, and that's often things we need to do as individuals, then we can get this back under control. But at the moment, you can see the numbers are increasing, leading to hospitalizations, leading to intensive care unit admissions, and that's a current state of affairs of the epidemic.
Patrick, thank you very, very much. Let's go to questions first from the public. If we'll go to Christopher from Margate.
What is the government's guidance to single parents who have regular contact with their children who live in a different county? I live in Kent and my son lives in Essex. What should I do regarding contact if Essex or Kent were to be a higher COVID alert level and the other remain at medium?
Well, Christopher, I think the guidance, alas, is that if you should go on the website, obviously, and check. But when places go into a higher tier from the basic medium, then there are restrictions on household contact, alas. So depending on how you define your household, you may find there are restrictions. But you really need to go onto the website to see where, what's going on in Kent and what's going on in Essex in order to be absolutely sure. Can we go to Sarah from Plymouth, please? Sarah asks, following the introduction of 3 new levels across regions, will you be reintroducing shielding? If so, where and how? Well, Sarah, at present, we're not reintroducing shielding, though obviously we keep that under review. We believe that the package of measures that we've got, the local restrictions that we've brought, the tiering system, will, if everybody complies, help to protect older people, help to protect the vulnerable. But obviously, we're going to keep it under constant review. Let's go to questions from the media. To Vicky Young, please, from the BBC.
Minister, you've just said that time is of the essence, but talks with local leaders are causing delays. Don't you now have to make a quick decision about whether you impose those extra restrictions on places, including Greater Manchester, or give them more money to persuade them? Which will it be and when? And to Sir Patrick Vallance, do you think that a short period now of 2 to 3 weeks of tighter national restrictions, some people call it a circuit breaker, would save more lives than the regional tier approach that is carrying on?
Well, Vicky, first of all, I think that it's much better if we can work with our friends in local government and local authorities across the country with the local tiered approach. I don't think it makes sense, as I've said, to be locking down the whole country when there's such a big difference in the infection rate across different parts of the UK. And it really doesn't make sense to, as I said, to lock down Cornwall or North Norfolk, to close down businesses there, which work very hard to make themselves COVID secure, in order to drive down transmission in parts of the Northwest. And yes, of course, we're working flat out with our friends across all those regions. And I pay tribute particularly to Liverpool City Region, to Steve Rotherham. I pay tribute to councillors in Lancashire. I talked to them this morning, and it's good that London has also come on board. As I said earlier, there is an issue outstanding in Greater Manchester, and I hope that the Mayor of Greater Manchester will also come come with us. There is, as I said, there is compensation, there is support that we're making available. I think, very good levels of support. I hope that he understands that, and the urgency, as you rightly say, is there, and that we've got to get this done. But it's far better to do it together, because we want the maximum local buy-in, the maximum local enforcement, and the maximum local compliance, and that means local leadership. That is, all the successful countries that have been driving down COVID epidemics across the world, whether in East Asia or in Europe or wherever, have been taking this strong locally based approach rather than imposing nationwide lockdowns. I think a local approach is the right one for us, and I hope that Greater Manchester will come on board. But as I said just now, obviously the national government must reserve the right to step in and do what is necessary.
We recommended in September about taking a circuit break, and the idea there was that actually a 2-week interruption would set cases back probably to the levels they were in August, and then at those levels test and trace is more effective to keep control. So that was the reasoning behind that. Where we are now, of course, is a different situation. It's crucial that where the R is above 1 and the numbers are high, we get the R below 1 for all the reasons that have been outlined, including, of course, the hospitalizations, which are increasing. So it's crucial that that's done, and there are a number of ways that it can be done. And as the Chief Medical Officer said, Tier 3 baseline conditions on their own almost certainly aren't enough to get the R below 1, but if you go up to higher levels in Tier 3 and start adding in other areas, then you can get they should be enough to get R below 1, provided they are fully implemented and we all stick to them. It's worth remembering that when the science advice is given, one of the things that we're clear about is that there are other harms that need to be taken into account. So there's the direct harm of COVID, which we all know about. There's the indirect harm because beds become occupied in hospitals, and that prevents other normal care, and that stops treatment of other diseases, cancers and cardiovascular disease and so on, and that's important to take into account. There's the economy, which clearly has effects on health as well, and can have very long-lasting damage, and their effects on society, including loss of education, in terms of disruption of schools, and in terms of loneliness, isolation, and the mental and physical effects of lockdown. So those are things that politicians need to take into account when making the decision. But clearly, anywhere where the R is above 1, which is most places in the UK, actions need to be taken of some sort, and the higher the levels, the greater the action needs to be in order to get the R below 1.
Thanks very much, Patrick. Let's go to Sam Coates of Sky.
Prime Minister, the presentation that you just showed 40,000 to 50,000, maybe more new coronavirus cases every day. This looks like we're getting to a point where significantly tougher restrictions are needed, if not nationally, then at least in vast parts of the country. The lesson of the first spike was the longer you wait, the worse it gets, and the more that costs the economy. So why not act more draconianly today? And Patrick Vallance, politicians all this week, local and national, have been squabbling rather than acting. Are people going to die as a result?
Well, Sam, I would just, I mean, of course, you're right that we do need urgent action in the areas where the virus is most prevalent, as Patrick has just said. But I draw your attention also to that point that Patrick just made about the R level. It is not rising in the way that it was a few months ago. You're not seeing the very rapid doubling of cases that we are seeing at the outbreak of the epidemic. There is the chance, if we implement the measures that I think need to be taken at a regional, at a local level, more than a chance that we can get the R down, because you need to get another 30% of that R down, and you're below 1 again. And that, I think, would be that is what we're aiming for. And we think that the budget of measures that we've set out would do it, as Patrick has said, if we all implemented them together. if we did it together with the local authorities, the regions that we've identified. And you're quite right, there's areas across the country that now need to do more, and it will take everybody working together to achieve it. But I think my judgment is that it's better to go for that route now than to go back to the bad old days of or the most difficult period of closing our schools again, alas, taking pupils out of school, forcing people effectively to stay at home, making it very difficult for businesses to continue in a way that causes long-term economic, social, and public health damage. So that's the trade-off. It is incredibly difficult. We think that the local approach is the best one for now. That's why we're pushing so hard for it. That's why I'm grateful to local leaders for what they're doing to help. But as I say, you call for more draconian measures, Sam. Be in no doubt the government stands ready to apply those measures as soon as we think that they're necessary.
Well, these are horrendously difficult decisions, and there are harms on both sides, as has been pointed out previously, and as I just illustrated. From a purely epidemiological point of view, it's important to go quite fast on this. It's important to make sure that you go hard enough to get the R below 1, and the sooner you do that, the more you get this under control.
Thanks very much. Can we go to Charlotte Ivers of Talk Radio?
Thank you, Prime Minister. Our listeners and viewers are very concerned about the future. Are you able to categorically rule out that we won't see a circuit breaker lockdown or something that looks like one in the next month or so? And Patrick Vallance, to you as well, you talked about tier 3 perhaps not being enough to get the R below 1. Would you be able to tell us some precise examples of further measures that might be able to help?
Well, Charlotte, as I said earlier on, and as I said in my answer just now to Sam, I rule nothing out. When you mentioned further measures that might be able to help, it might be actually appropriate to bring Susan Hopkins in to talk about some of the testing possibilities, because I also mentioned those in my opening remarks. But Patrick.
Well, I mean, is Susan wants to tackle that?
So first of all, I think that the most important things that we should do are our personal responsibility. We need to take that first. Reducing our number of contacts that we have in all areas, even in tier 1 and tier 2 areas, are really important. Keeping those contacts low, working from home if you can, are all really important measures that we can take. Reducing our contacts in indoor spaces, particularly those that are less ventilated. And then, of course, there's testing. We are already ramping up and increasing the testing. We're at 300,000 tests a day today, aiming to get to 500,000 by the end of the month, and looking at new technologies where we can find asymptomatic infection, particularly in the areas that are most at risk for transmitting to vulnerable individuals, such as care homes and hospitals. But we're also looking at how we can do this in universities and schools to keep education open as much as possible and as long as possible over the winter period, while protecting the rest of the population.
And I think the other thing to add to what Susan said is that clearly isolation is important, as the Prime Minister said. I mean, testing only works if people isolate. And so making sure that we keep as many of us out of circulation as possible who are infected during the time of infectiousness is crucial. And in terms of the extra measures, they're all laid out, what the extra measures are. And I think that's where local knowledge and local insight can add and make sure that enough of those extra measures are put on top of baseline tier 3 in order to get this working and get the R below 1.
Thanks very much. Thanks, Charlotte. Let's go to Matt Dathan of The Sun.
Thank you, Prime Minister. To follow up, Charlotte, families up and down the country will be spooked by this latest idea from government scientists for repeated circuit breakers over each school holiday. Are we really looking at a Christmas lockdown circuit breaker? Sir Patrick, would it still be effective to do a circuit breaker over half term? And I've got to ask, Prime Minister, about Brexit, I'm afraid.
Yes.
You've left your door slightly ajar today by telling the EU you'll still be able to talk to them if you see a fundamental change of approach from them. But when will your door slam shut? Is it New Year's Eve? Are you still going to pick up your phone then, or would you rather die in a ditch? Point of phrase.
Yeah. Well, look, why don't I take the bits that are meant for me, Patrick. Look, Matt, we want the local approach, the regional approach to work. We're giving it our best shot. We're working with local, regional mayors, city mayors around the country, as you know, to get this thing done. And I hope that everybody will take their responsibilities and drive it forward, because I don't want to see this country constantly locking down in the way that you describe. We did it in March and April. We did it for a long time, and I think that the regional approach, keeping our kids in school, keeping our economy moving as far as we possibly can, and that's what we're able to do with this approach. I think that is the best way forward, because I do think that we can drive down that R, as I was saying to Sam Coates earlier on, and on where we are with our friends and partners in Europe. Look, I think there's we've got to the stage, alas, where they don't seem to want to progress a free trade deal. That was pretty clear from the conclusions of the summit. They don't want to go any further unless that fundamentally changes. Then we're going to have to come out on Australian terms, but we'll prosper mightily nonetheless.
In terms of the circuit breakers, the circuit breaker is a way of really pushing measures to a hard level to get R below 1 quickly, and then to release it. And that would break transmission whenever you do it, and it would therefore slow and buy some time in the epidemic. So it's a way of doing it locally or nationally, but of course it's in a way just an extreme version of what you're trying to do to try and get R below 1 anyway. So there are different ways in which you can get R below 1, and the circuit breaker idea is one way to do it in a sort of short, defined period.
Thanks very much. Let's go to Bill Jacobs of the Lancashire Telegraph.
Thank you very much, Prime Minister. Parts of Blackburn and Pendle have been under severe coronavirus restrictions since August. How long do you think this latest Tier 3 is going to take? And how long do you think people can put up with it?
Well, Bill, you're asking the most important question, which is really about people's ability to keep going with this. And I just want to say a massive thank you to people in Lancashire who, you rightly say, have been going through some pretty tough times for a very long time now. I want to say thank you to local leaders, council leaders that I talked to this morning in Lancashire for the steps that they're taking to reduce the spread of the reduce the spread of the virus in Lancashire. And you know, we can do it. We can do it together. The quantum by which, the amount by which we need to reduce the R is not as big as it was right back in the beginning of the spread of this disease. If we all work together on the measures we've outlined, we can definitely do it. And as I'd like to see Lancashire and everywhere else coming out of Tier 3 as fast as possible.
You've missed one, Prime Minister.
I have. I'm so sorry. You're quite right. Let's go to George Parker of the Financial Times. Sorry, George, that was not intentional. Forgive me, George.
Thank you, Prime Minister. It does seem odd, you know, in a press conference where we've been talking about a pandemic, to also be talking about Brexit and the idea that we might add more economic uncertainty into an already very uncertain time for the country, particularly as the dispute seems to turn on an issue of fisheries, which accounts for about 0.1% of the British economy, and a dispute about how free you are to hand out state subsidies to industries. My specific question is this: you say that you're prepared hearts high to take the country out of the transition period without a trade deal on the lowest common denominator trade terms that you can have. How do you explain that to people, for example, in the car industry, who will face tariffs of 10% on their exports, or indeed people in upland rural areas who produce lamb or beef who face tariffs of between 40 and 100%? Are their industries expendable for Brexit?
Well, George, as I've said this morning, we're very keen to get a Canada-style outcome, as I explained earlier on, but I think we can prosper mightily under an Australian version if we have to. It's pretty clear from what happened at the summit today that our friends don't want to negotiate, don't want to offer us the Canadian option. So we've got to make the necessary preparations, and I've no doubt that all the sectors that you've mentioned, this whole country can get ready for an Australian exit. And as I say, I'm absolutely certain that we can do very well indeed. Thank you all very, very much. Thank you for your time.